This conference will now be recorded.
If I could please get a roll call from Kara.
Sure. Chris Jasper.
I'm here.
Lawrence Hartman.
Here.
George Griffith.
Here.
Mike Bryant.
Present.
Mark Murphy. I think he's on, but he's going to be working dispatch, so I think he's listening, but I do think he's there. Jeff Anderson.
Here.
Richard Pierce. Here. Rob Denner.
Here.
Jackie Angelo.
Here.
Taylor People. You have a form?
Okay, for everybody who is listening online, could you please mute you're talking to a lot of people? Okay, if I could I please get a motion to approve today's agenda?
Pierce makes a motion.
Okay, do I have a second?
Jasper will second.
Thank you. Any discussion? All those in favor signal by saying aye.
Aye.
Against, same sign. The motion carries. And then likewise, can I get a motion to approve the May 12, 2022 minutes?
Pierce will make a motion.
Okay. Do I have a second?
Griffith will second.
Thank you. Any discussion? All those in favor signal by saying aye. Aye. Against, same sign. Motion carries. Blake, do you have a report for us?
I do. Actually, I'm going to open by turning it over to Julie Mass. Julie is going to give us an update on the 988 initiative. Julie's with DHS. Julie, are you there? Can you hear me?
I am. Can you hear me?
I can. Go ahead.
Okay, perfect. Thank you for having me here. Like Blake said, my name is Julie Mass, and I'm with the Department of Human Services, Mental Health and Disability Services Community Division, and I'm the project director for the state's 988 cooperative agreement with SAMHSA. I thought it would be helpful to just do a brief overview of the National Suicide Prevention Lifeline, or NSPL, and then kind of jump into the changes that the implementation of 988 could have on that. So the Lifeline is a 24/7 crisis line for individuals who are suicidal, in a behavioral health crisis, or experiencing emotional distress. It's a network of over 180 call centers throughout the country. 2 of those call centers are here in Iowa. We have Foundation 2 in Cedar Rapids and Community Crisis Services and Food Bank in Iowa City. How calls are currently routed through the Lifeline is that when an individual calls, the area code of the phone that they are using determines the center that it is routed to. And then if the center does not answer the call, it continues to roll throughout the network until it is answered. Chat and text routes a little differently. It goes to the first available counselor and then routes through the chat and text network, but they are in the process of testing a new system for routing them that is the same as how calls are routed. How 988 could potentially change the Lifeline is it's not just a change in a phone number. In 2020, the FCC designated 988 as the 3-digit dialing code for the Lifeline. It was signed into federal law in October of 2020, and it goes into effect July 16 of 2022, which is very soon here. So we are in the process of preparing for that transition. What we are doing is we have contracted with our 2 centers to provide 988 crisis services. And really the intention of the 988 change isn't, like I said, it's not just a change in a phone number, it's a change in how the Lifeline interacts with our state's crisis system. Right now, it's really a parallel crisis line. And the intention is that it is an integrated piece of our crisis system. When you look at the national standards for what a quality crisis system is it's comprised of 3 components. someone to talk to, someone to respond, and a place to go. In Iowa, we have Your Life Iowa, which is also a 24/7 crisis line for individuals in a behavioral health crisis. And we are in the process of assessing what 988 and Your Life Iowa, how that's going to interact and what that's going to look like. We also have mobile crisis response in a good portion of the state, which is someone to respond. And then we have crisis stabilization residential services, which is a place to go for individuals in crisis who need stabilization. What we don't have and what we're currently assessing to see if 988 can provide for us is a single access point into our crisis system, and then coordination between those components of the crisis system. So that if somebody calls 988, which is a number that's going to be really easy for people to remember, and they need additional help, they need more than just somebody to talk to, they can be directly connected to someone to respond or a place to go. So in our contracts with our centers, we are requiring them that they provide the 24/7 call, chat, and text. Foundation 2 is going to be the primary call center for Iowa, and then community is going to be the backup for the calls, and community is going to be the primary chat and text answer center for Iowa, and Foundation 2 is going to be the backup center. In addition to that, community is a national backup center for chat and text, and are really considered a national expert in chat and text. So we're very fortunate to have that in our state, as that's a piece that's really lacking in a lot of other states. We are also in the process of looking at how our 988 centers can provide warm handoffs to all of the mobile response teams in the state with an effective date of fall of this year. So we're really looking at how we can start that coordination piece between 988 and our local community crisis services. We know that the connection between 911 and law enforcement and 988 is going to be a huge component with 988. And I feel that there's going to be a lot of conversations in our very near future about what that's going to look like. Right now, we're really focusing on building up staff capacity in call centers so that we can answer as many Iowa contacts in Iowa and prevent them from rolling to other call centers out of state. That's a really high level overview of where we're at with 988. Happy to answer any questions, or Blake, you can, if people have questions for me, you can feel free to give them my contact information as well.
Yeah, sounds good. We will get your contact information out, at least your email, within the minutes. But are there any questions here? Let's do the room first. Okay, it doesn't look like in the room. How about online? It doesn't sound like it. Well, if there are any questions down the road, specific to 988, the interrelation between 988 and 911, you'll have Julie's contact information. Everyone knows how to get a hold of me, and we can hopefully try to start addressing those. Hopefully, within your PSAPs, you are starting to think about some best practices and starting just to think about how to do some of those handoffs and transfers, and how those numbers and just can interact. So that was one of the reasons that I wanted to have that as a presentation today. So thank you, Julie.
Thank you.
All right. So we already talked about 988. Just to let everyone know, I did send out an email scheduling 2 webinars That will be held June 29th and June 30th. Those are to go over a number of the programs and legislative changes as we cross into fiscal year 2023. Those will also be recorded, so if you can't attend on those 2 days, you will still be able to catch up on everything you might have missed. One of the things that we will be talking about at that program update is House File 2436 and the form that you all use, or PSAPs use to report their expenditures every year. As a reminder, there was a change to how those costs are reported. It now only asks for direct costs instead of all costs. We have convened the first meeting of that work group. We've taken our first stab at what can be eliminated, what can be changed with that form. We'll be circling a draft around the work group here in the next week or so. The timeline on that is still kind of what we've been using in the past, where September-ish timeframe is when that goes out statewide, and you can start submitting your expenditures at that point. So expect a much streamlined form here in the upcoming months, but we'll talk about that a little bit more for those that submit that form or manage PSAPs at that the program update at the end of June. The next topic there, when Comtech and PSAPs experience no record found, there's a very defined process on getting those corrected and getting those ALI and ANI records loaded into the Comtech ALI database. What we've seen a lot of is no record found for PBXs or multi-line telephone systems. So think perhaps either schools or hospitals or large businesses. And where we're seeing an issue is where third-party vendors or the IT department manages those numbers. All of those numbers should be provisioned within the ALI database. However, we're seeing like one number or like a DID number that's provisioned. So all of those other sub-numbers get a no record found and end up default routing to state radio. So we found this specifically in one county where the county government was being maintained by a third-party vendor / the IT department, and those numbers were default routing. So we're working on some messaging. The problem is we don't know what we don't know, right? Like we at the state and Comtech certainly don't know what PBX systems are out there as far as businesses, schools, hospitals. So we're working on some messaging to try to capture kind of that gap. I've been included on a lot of the email notifications that go out to the telephone companies when one of their numbers is caught up in this. And for the most part, they turn around and reach out to the customer, let them know that that is the case, and let them know they need to start provisioning those numbers. Again, we don't know what we don't know, and a lot of times we don't know about it until one of those numbers tries to reach out and call 911. So this will be a topic at the program update as well. We're trying to get this word out. It's probably a good place to start at your city and county governmental office level and start trying to make sure those numbers are provisioned, they are in the system. So again, just kind of getting that word out as we work towards probably refining that message and spreading that word further to make sure that all of those numbers are captured. Any questions on that? I know that was a big topic. Okay. Just a reminder that the consolidation grants, that's the up to $200,000 for physically consolidating. That is set to sunset with the end of this fiscal year. We did have, that's been on the books for 3 or 4 years now. We did have one PSAP take us up on that. And actually we are in the process of processing that final payment. That was the Fayette County Service Board. Of course, the council approved that a number of months back. So that is wrapping up and they are closing that grant out. On to GIS information in May. We had 7 counties meet the benchmarks. That gets us up to 95 counties for period 2, the second 6-month period. There is still, of course, the month of June in order to get those last 4 counties. Couple of things to talk about. We did go live with the GIS-based MSAG earlier this month as well. That was successful. So if you are noticing any issues or changes, because of that transition, make sure to either reach out to myself or Comtech to make sure we all are on the same page with what may be going on, but haven't really heard any issues that stem from that. Similarly, GeoCom is updating the portal where you all upload your GIS information into. That is called GIS Data Hub 2.0. The training for that has been scheduled for June 15th to 21st. That training is really geared towards GIS specialists. If you are a PSAP manager, you're more than welcome to attend, but it will be a little bit more of a technical webinar to talk about that new system. It's also the time of year where we start talking about benchmarks for the upcoming fiscal year's grant. We had a little back and forth, and Lawrence, who sits on the 911 Council, kind of talked us out of what our initial plan was, and I think we kind of have a good vision of where we want to go for the next 2 fiscal years now. So really the benchmarks stay the same. It's 98% GIS match rates, 98% hourly road center lines, still 0 critical errors. But instead of uploading it over 2 6-month periods, because we're now actively using that data, we need the data to be provided more often to make sure it's still accurate. So for the fiscal year 2023, which would be this July through next June, we are going to have that grant be, instead of a 6-month period, it'll be every 3-month period that you'll need to upload that information. So it'll be, we're asking for it quarterly. That'll be paid out at the end of the quarter just to streamline how often we're making those payments. So at the end of every 3 months, the folks that made that benchmark will receive their funding. The dollar amount remains the same. It's the $12,000 for the year, and this way it's just split up 4 different ways instead of over the 2 different periods. And just wanted to be perfectly transparent and kind of project where we're going with this. Fiscal year 24, we're probably going to move to monthly. So that means monthly uploads, make sure that information is as up to date as possible. But we also know there's business processes that come into play here, so we're really kind of giving you lots of heads up to try to get those in place for the next fiscal year, 2024, where we'll be looking to move to monthly uploads. But for this upcoming fiscal year, we're looking at quarterly. Any questions on that? All right. Moving on. On the agenda for this month, there is a $50,000 request for additional activity workbooks. If you remember, the council approved this a number of months ago. It was a really limited quantity. We kind of took the approach that we didn't want to spend a lot of this fund if there was other interest and other training that folks wanted to do. That never really came to fruition. So looking to spend $50,000 to print out 10,000 English copies, just over 2,000 Spanish copies, and again, make those available to PSAPs or anyone who might be interested in receiving those. That would leave just under $2,000 for the remainder of the year for any unexpected expenditures that might come up, and I'm not expecting anything. So that gets us really close to zeroing out that $100,000 that replenishes every year. In perfect transparency, when we looked at printing that quantity, DAS Print was going to have to get a head start on this, so I worked with the executive committee of the 911 Council to give us a thumbs up and to go ahead to start that. I think we would still like the full council approval just to make sure it's all on the up and up. But again, we kind of already did commit that funding, anticipating that the full council would approve this. Any questions? With that, Lynn from Zetron, are you on?
Yes, I am. Good morning. Can you hear me okay?
Yes, we can.
All right. We've had a busy May and start to June. You can see on the list, Howard, Ida, Audubon, and Marion PD all have gone live since we last met. And next up, we'll be working on Wright County and O'Brien County. We'll be going live in the next couple weeks in June. Next slide, please. You can see the updates here. All the yellows are moving over to green. Still lots of room if more people would like to sign up. Next slide, please. And as always, if you'd like to be put on the mailing list for our newsletter, just send an email to lynn.warren@zetron.com and we'll get you put on the list. Or if you have any questions about the Iowa Shared Services Program, we'd be happy to put you in touch with someone who can answer your questions. Any other questions? Thank you.
Right, and that ends my update as well. If there's any questions, I'd be happy to take them.
Okay, thank you, Blake. Moving on, training fund requests, as Blake had mentioned, about the printing of those 911 books for children. The Executive Council did approve this, but I would like to put it towards the rest of the council for approval. Would I have a motion to approve that spending?
I make that motion.
Okay, we have a motion. Do we have a second?
Second, roll second.
Okay, any discussion? All those in favor signal by saying aye.
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 Against, same sign. And the motion carries. And that is the only training fund request we had. Moving on to reports of officers, boards, and standing committees. Does anybody in this room have any technical advisories?
I have one.
Okay.
Mr. Chair. I have some additional FirstNet information that I received after last month's meeting, so I'll just read it for the council here. May already be aware, but FirstNet focuses on in-building coverage. The FirstNet Authority Board has voted to use network reinvestment funds to expand coverage indoors in a move that will allow its network partner, AT&T, to offer indoor coverage extension service to FirstNet customers. FirstNet said that they approved network reinvestment is intended to increase FirstNet coverage where public safety agencies operate indoors, such as police headquarters, fire stations, emergency communication centers, and other critical sites and field locations. The agency described the indoor coverage enhancing service as a small cell-based RAN extension that will be available to first responder agencies which subscribe to FirstNet services. The First Responders Network Authority will be receiving about $18 billion in payments from AT&T over the 25-year term of its contract to build out and operate the nationwide FirstNet network for public safety. An estimated $16 billion of that is expected to be reinvested in the network as it is required under the law which established FirstNet. The FirstNet Authority established a roadmap in 2019 which laid out priorities for guiding that reinvestment, including indoor coverage. So just wanted to share that. I have a sheet here I'll hand out.
Okay, thank you.
Yep.
Any others in the room? Okay, does anyone have any technical advisories that are online? Okay, hearing none. Blake, do we have anyone from there online? Or here?
With Chris's departure, right now, we're kind of in a holding pattern.
That's fine. I didn't know if there was somebody, I don't know if who's online, so.
Still trying to work through DAS to get the position approved to be able to fill.
Sure. Okay, thank you. All right, moving on then, an update from U.S. Department of Homeland Security, Cybersecurity and Infrastructure. Jim, are you on the line?
I am. Thank you very much. Good morning. How do you copy?
Just fine, thank you.
Great. I'm dialed in this morning, not on the computer. I'll start with Chris Myers. As you know, Chris has been hired by CISA and has started his onboarding this week. And I know I've already been texting with him and emailing with him, and he's hitting the ground running. And if you haven't received it already, you should anticipate getting his new phone number and his new email address. And I know he's very excited to get to work servicing and continuing to support the state of Iowa. I'm sure he'll be at 100% by your next meeting in a month, and will be the representative. So I've enjoyed the opportunity to work with Iowa over the last several months, and will continue to partner with Chris, but I don't think he's going to need a whole lot of help, especially in the state of Iowa. Second, I'd like to report that there is a new technical assistance catalog out, technically called the Service Offerings Guide. It's something that hasn't been modified much. It's supposed to be a living document, and so it's just some slight refreshers, and it's available on the CISA Emergency Communications Division webpage. And then finally, I just want to thank Iowa for its participation in the NASNA workshop this past month. Hopefully it was a beneficial experience for you, and it was a pleasure to meet some of the Iowa folks there. That concludes my report. Thank you.
Okay, do we have any questions for Jim? Jim, I just want to thank you for your help stepping in there during this time, and look very forward to working with Chris again. So thank you. All right, moving on. Do we have any report from the Chapter 34A Administrative Code Committee?
Last month thank you, Mr. Chair. Last month I sent out an email trying to collect some data. Right now we're collecting data on the CenturyLink Lumen issue. So I've got some movement in that area. I spoke with our county attorney, and we're in a fairly good spot for Marshall County because we have not taken ownership of that bill nor paid that bill. So as soon as I get a little bit more information from him, I'm going to send that out. What I would like to request outside of that work that's being done and the emails that are going out, is there any direction that the board would like the 34A committee to begin working on so that we can do anything with the upcoming legislation or whatnot?
That's a good question. I mean, to me, I've got a similar bill to my center, and our policy is that all bills paid must be itemized, and there's no itemization.
Correct.
I don't know if there's any requirement from the state auditor, if I were to be audited and I paid a bill that wasn't itemized, if that causes an issue for my county or my service board.
So there's a couple of things that I've been able to learn at least since then. So I've received 2 bills for my agency. The first bill that was lined out again, these are brand new account numbers that were created. So I went back historically. The second month, they apparently had enough phone calls and enough emails that they went to more of a cryptic monthly services, and that is it. So the thing about it is that is something that was previously billed way back when, before the CenturyLink bills were shut down, but that is also something that was forwarded to the state because it's a whole statewide migration. So the question becomes, is this a triple dip? So they're billing the state, they're going back and billing the PSAPs, and then what are they billing the customer? So that's where the county attorney is looking at. So he's reaching out to the County Attorneys Association as well as the AG to get some direction there. And then my county attorney is going to be sending a letter to CenturyLink. So I'm hoping to get a little bit of resolution before next month so that I can share the results with other agencies. What I will tell you is for those agencies that have not taken ownership of that bill, that's going to be a little bit of an easier fix versus once you pay it, you've taken ownership and accepted the bill. So that's kind of where the issue lies. So I'll be sending out, as soon as I get a little bit more information from him, I'll send out another email that we can maybe push out to all the PSAPs, to see kind of where everyone is, if they've made any progress, or if they've even contacted their county attorneys, because that would be the next step, if everyone gets together in the association, and then all these attorneys contact Lumen together. The show of, you know, a grouping would be more powerful.
I think that's a great idea, and so, I know everybody's busy, and county attorneys are no exception,
Right.
and they may not even be aware that this is an issue. So if you've had such an issue, a billing that sounds like the same thing, please make sure that your county attorney is aware. I will be doing that myself to make sure that he is paying attention as well, and I think there's certainly strength in numbers. If we can get a lot of county attorneys on board, will definitely make a difference. Legislative, I can't really think of an angle there.
The last thing that we did, okay, so that was after the first complaint that I made with the Iowa Utilities Board, but, you know, and there will be another complaint. I know, honestly, it's not gonna go anywhere because they've kind of made it clear that there's really no decision there. They really want the FCC to make that decision. So, but by still making the complaint, it shows that, hey, there's still a problem, it is still happening, this is what, you know, we need to fix. So after I get a little bit more direction from my county attorney, and that's going to be Jordan Gaffney, I'm going to send out another email, and I'm going to ask everyone, okay, have you contacted the county attorney? If you have, can you give me their contact information? That way I can forward it to mine, and then they can get together in their grouping and maybe see what we can do. As far as legislation goes, you're right. I'm not sure where we're going with that. I do know that when the last I spoke to our senator and House of Representatives, the thought was, okay, there's really no bill on this side. There's no bill on this side. We're all kind of waiting to see what, FCC does. So it's kind of a waiting game at this point.
Right.
But if we can get at least this new issue resolved, that would be a huge step, you know.
Okay, so basically everybody be as proactive with this as you can and jump on board so we can talk with one voice.
Sure.
Yes, Blake.
A couple other updates on this, kind of looking outside of the state of Iowa and keeping in mind that every state's regulatory and statutes are different. Minnesota's 911 program did file a complaint with their public utility, their version of IUB, how about that? And they are taking up this issue in Minnesota. Again, their regulatory environment is different than ours. This weekend and the next week, I'm at NASDA and NENA, where the FCC is at. They've been pretty tight-lipped. There's an open proceeding going on this topic. I don't know that they'll say anything about direction that they're going to go, but if I am able to hear anything, if they say anything, if they say they're going to close it, if they say, okay, we're taking the next step, I'll let the group know. But again, they're in the middle of the proceeding. They normally don't say much, so I don't know that anything will come from that. But I just want to again kind of cast that what's going on outside of the state as well.
Okay. And thank you for that information. My county attorney thought that was very, very useful for what he's trying to put together. So.
Okay, very good. Anything else?
Not from the 34A, thank you.
Okay, then do we have anyone from Baseline Knowledge for 901 Communications Professionals?
So I am not sure. I need a little bit of direction from the board. Where do you want us to go with that? So I've got the information as to what direction I kind of like to go. I still need to build a committee around that, find out who's interested in it. But then I'd like a little bit of direction from the board as to what are you hoping to see in that?
Right. As far as I understand from the very beginning, it was just to make sure that the training that's being required, not just through, I know a lot of people think about ILEA and the training that's provided there, but that's really just only a piece of it. There's, training that PSAPs perform all over the place internally and whatnot. And just to make sure that dispatchers in general and dispatch supervisors feel like the training is out there that they need, whether it's ILEA or anywhere else, and that their needs are being met, and that we're up to date and keeping up with both technology and the way people use phones, the way people use 911, and how that all works in public safety, and really just come up with any not necessarily fixes, but maybe recommendations, because we are an advisory council. We don't make any rules per se, but we do give advice. And I know over the years I've heard complaints, and not, again, I think a lot of people think that we're just talking about ILEA, and I'm not. I've sent people to classes that I thought would be beneficial because of the title, and when they come back, they just look at me like, I don't even know why I went there. We didn't talk about anything that will ever apply to me. So it's an entire broad conversation, and I think this council is in a position to help with that. If there are things out there that dispatchers feel they're not getting, we can certainly bring that to the attention of not only ILEA, but even the private sector that does some of these things, and maybe we can recommend as a council where to find that, and maybe bring it into the state if it isn't here now, whatever. So just to make sure that we're always fresh and new in our training is essentially what we're looking for.
I just have a question on that. As we all know, all of our agencies are fairly short. Everyone can agree on that. What I will say is, in looking at the training and as much training as I've done with my background, that is one of the huge holdups that have agencies not sending their people to training. It has to be extremely justified. So there are different, things that we can do about that. But do you want us to include anything for like hiring, retention, those kinds of items?
I think retention is critical because we all know where we're at with hiring.
Right.
It's almost impossible.
Right.
So holding on to good dispatchers is very, very important. And I think if there's one group of people, and I know we have a lot of dispatchers probably listening in, if there's one group of people involved in public safety that always feels forgotten, it is the dispatcher.
Absolutely.
And somehow we need to remedy that. We need to bring them out of the shadows and be more part of public safety as a unit. And that's something that I sometimes struggle with at my office is we do a lot of training for how we're going to handle the situation. And then when we're all done, we're like, oh shoot, we probably should have had dispatch there. We should probably, I will bring up the biggest thing that people are talking about now, once again, with school shootings. You're doing a lot of training inside schools. You're doing a lot of training, from the officer's point of view and how they enter. Are we doing training on how the dispatcher is going to handle that on the other end? Does the dispatcher know what you're training your officers to do, what you're training your students and your faculty? Are they on the same page? They may be faced with a time where they're on the phone for a long period of time with someone that is inside that building. And are they saying the right thing to them? Are they contrary to anything that you've taught them, as far as the students and the faculty? So that's something that I've been thinking about lately, but I think you could look at that all, not just in an active shooter situation, but any emergency situation. Is the training outside in the field matching what you're asking your dispatchers to do? And do they understand what you're doing? And do you understand what they have to do? Are we all on the same page?
Okay. And this will be a little bit of a sideline conversation, but one of the things that I've thought a lot about, and I've actually mentioned this to APCO over the years, and I think that they're working on something nationally for it, but for the state of Iowa, we have supervisor classes, and Blake and his team do an absolute great job on that, but I'd like to see some part of a breakout specifically designed managers and directors and supervisors that deal with, when this happens, this is what your dispatchers are dealing with, these are what they need, this is what's going on. to deal with disaster operations, crisis negotiations, active shooter. Like maybe a one-day course, 8 hours, because I think it's extremely valuable for those directors, supervisors, managers to have that information for their center, because, you know, one thing that we don't do a lot of is sitting on the floor because we have a very different role. Is that something that the board would be interested in looking at?
I certainly would, yes. I would imagine, does anyone on the council have anything to add to that? I personally would. Okay. Sounds like we have some nods, so.
That's all I have, Mr.
All right.
Mayor.
Okay, thank you, Rhonda. Lot going on. Any legislative issues at this point? Don't think so.
I'll talk about one. We are going to be working on admin rules within 911. Part of this is a process that we as a department have to go through every 5 years for an annual rule review. That's the entire Homeland Security Emergency Management Department, not specific to 911. That being said, with one of the bills, the Service Board and EMA bill that passed, we'll need to open Chapter 10 up anyway. And part of the strategic plan that Allie and I have been working on has been, one of those work groups has been kind of the rules, and there's some updates that probably need to be made just as far as terminology and the out-of-date NENA standard that's referenced for voluntary standards. So not saying that it'll be the next month, but we're going to be working towards that rule update here in the next couple months.
Very good, thank you. Okay, any other legislative issues that anyone else wants to bring up? Okay, do we have any information sharing by council members? Anyone online? Okay, I don't have any unfinished business or new business or travel requests. So do I have any business from the floor inside the room? Okay, do I have any business from online? Okay, hearing none, then I would entertain a motion to adjourn. Everyone wants to say.
Pierce will make the motion.
Okay, we have a motion. Do I have a second?
Second.
All those in favor, signify by saying aye. Aye. Okay, we're adjourned. Thank you, everybody. Thank you.